So we're going to get started. First, just welcome all of you. I know everybody is busy, and we appreciate you being here with us to talk about going back to school. Going back to school is a big decision, and we realize that you have a lot of options out there. So we're happy to present this, give you some information on Frontier Nursing University's Family Nurse Practitioner program that hopefully will help you with the decisions that you're making. We're super excited to be able to do that. I am joined tonight by um, Dr. Nancy Pesta Walsh. Well, let me back up. I apologize. I'm Dr. Audra Cape. I am the department chair for the Department of Family Nursing, and I have been with Frontier as faculty for about 12 years. I spent the majority of my time as a clinical faculty assisting students through their clinical practicum, and then moved into administrative roles within the last 2 years. So I live in Shelby, North Carolina. I do work clinically. My clinical focus right now is skilled nursing facilities and long term care. However, I spent about 12 years providing primary care to people with either not enough health insurance or no health insurance. So that's kind of my background. Now I'll introduce you to the other folks that are here. So we're joined by our clinical director and some other facilitators. I'm going to have them introduce themselves, and we'll start with Dr. Pesta Walsh.
Good afternoon, everybody. Good to see some faces here at this meeting. I'm Dr. Pesta Walsh. I am a family nurse practitioner, and I'm also a psych mental health nurse practitioner. I'm the clinical director of the Family Nurse Practitioner Department. I've been in that role for about 6 months. Prior to that, I was a full-time clinical faculty. Prior to that, I was a full-time didactic faculty. So I've been employed with Frontier for going on in October, 14 years. So this is a good place to be. I work clinically, doing psych mental health 1 day a week. And you can see I'm at work right now, picking up a shift in the urgent care. So, but my role at Frontier is as the clinical director. So welcome.
Thank you. And then we have some other facilitators. Katie Graves is here. You want to introduce yourself?
Hello, everyone. Thanks for joining us. My name is Katie Graves, and I am one of the clinical advisors here at Frontier. I work in the clinical outreach and placement department, and we'll talk a little bit about that later. But I have been at Frontier almost 6 years. So it's a great place to be, and I love working here. So welcome.
Thank you, Katie. And then I think we have admissions. Tamika, is that you?
Yes, it is me, Tamika Bradford, admissions counselor in admissions. Hello, everyone.
Perfect. And then we have Quincy, who is here to help us stay on track and keep us from going too far off on the rails. So welcome, everybody. Thank you for helping facilitate. Did I miss any facilitators? We got us. Perfect. All right, next slide, please. So we'd like to start by just sharing with you the purpose of the Department of Family Nursing here at Frontier. And the purpose really drives everything that we do, from curriculum design to course design to outcomes, student learning outcomes. We want to prepare family nurse practitioners to care for families residing in rural and other underserved areas. So that's one theme that you'll see consistently threaded through Frontier, is that focus on rural and underserved populations. And we do this by offering a structured off-campus, community-based FNP, Family Nurse Practitioner specialty track. Next slide, please. So to expand on that a little bit, one other theme that you'll hear a lot if you're a part of the Frontier community is our culture of caring. So the culture of caring is sort of like the backbone of how we conduct business. And what that means is we're all, nurses, and you know that caring is a huge part of what nurses do. However, to take that a step further into the educational arena, it means that we treat each other with respect. We focus on being honest and trustworthy in our interactions with each other. No one person has more value than anyone else at the university. We are all equally um, valuable and effective, and it's together, working together and having that shared mental model that we are so successful in what we do. You'll be using your community as your classroom, and that's a nice thing about Frontier, because research has shown that students who study and learn and do their work in their community tend to stay in their community. So, and that takes us right back to that underserved and rural population. You will be learning from the people and the patients within your own community, and that's a really dynamic place to be. You'll be able to study from home. We do have a couple of required trips to our beautiful campus in Versailles, Kentucky. There's one trip for an orientation, and that is generally about 2.5 days long. And then a second trip, you come back to campus for 4.5 days for a clinical immersion experience where we go through some workshops and we see patients, and we really work hard to prepare you for your clinical experiences. Some of our achievements: we have nearly 100 years of experience in graduate nursing education and midwifery education. So we've been around for a long time. We've been doing this community based for a very long time, very successful. We have students and alumni in every state. We currently have over 2,500 enrolled students, and we have over 9,000 graduates. So we have a big footprint. Some additional achievements: Frontier is a national leader in diversity, equity, and inclusion. We are a 6-time winner for the Insight into Diversity Higher Education Excellence Award. Frontier has also been recognized for the past 3 years as a great college to work for. We received the AACN, the American Association of Colleges and Nurses, 2023 Award for Inclusive Excellence, Belonging, and Sustainability in Nursing, which is a pretty rigorous process. That's a really that's a hard one to achieve. And we were also named the academic honoree for the 2024 Healthy Work Environment Award, presented by Sigma Theta Tau. So we're proud of all of those accomplishments. We were the first FNP program in 1970, have celebrated the 50th anniversary of our FNP program in 2020. And our FNP graduates have an overall certification pass rate of 96%. So I want to pause on that for a minute. When you're thinking about what school to go to and you're doing your search, that's certainly a statistic that you're going to look at to determine the quality of your program. And our program has been in that range, the 96 all the way up to 100% certification pass rate, for a long time. The FNP department has had that for over a decade. So our quality does show itself in your certification pass rates. Next slide, please. Dr. Pesta-Walsh, do you want to talk a little bit about our student support?
Sure, I can. So when you are students at Frontier, we don't leave you out on your own little island to get through school. It's hard enough. You guys will be in your own communities trying to do didactic work, trying to do clinical work. And we feel that continued support is really valuable and important. So we have a lot of staff members in various departments that help. And then you have a lot of faculty, and you'll have didactic faculty for each course, right? Teaching the course. When you get into clinical, you kind of have one person that is in your region, the regional clinical faculty, that knows your area and knows, the resources in your area in terms of clinical sites. And they're kind of assigned to you at the beginning of your education, and then we continue to work with you all the way up through graduation. We also have a great team of academic advisors. They help guide you during your didactic and sometimes in your clinical portion of your program. And then we have a wonderful team of the clinical advisors in the clinical outreach department. We have all of these people are working together to support our students. We have student mentoring groups, financial aid and scholarships. Our school gives out a very high number of scholarships. I want to say last year it was $750,000 in one of the scholarship cycles. I mean, it's pretty extensive. We have a large library service with several librarians that are working to support our students and our faculty. And then we have an Office of Diversity, Equity, and Inclusion. They help to lead the student interest groups in various areas, and then they coordinate the Diversity Impact Conference that we have every single year. Next slide. Do you want me to cover this one too, Dr. Cape?
Yes, please.
Okay. Here we're talking about scholarships. So we award scholarships 2 times a year, spring and fall term. Once you have been through enough courses that you get 24 credits earned at Frontier, you can qualify to apply for scholarships. Here's that number, 2023, $1.2 million in scholarships. That's a huge amount. Think about that in relation to the number of students that we have. There are a lot of students that apply for scholarships. You do have to have a minimum GPA of 3.25. And every scholarship amount is different, but we have many, many scholarships available, more than 20. So encourage you to apply when you get the chance.
Thank you. And I believe, Katie, you'll talk to us about clinical outreach and placement.
Yes, ma'am. I am part of the clinical outreach and placement department. When you are accepted to Frontier, and if you decide to come here, you will be required to find your own clinical sites and preceptors. This can sometimes be a challenging process for students, but that's why the girls and I on my team are here for you all. We help support you through that search. We have a wonderful database called our community map, and it houses thousands and thousands of sites and preceptors that students in the past and current students are using for rotations. So you will have access to that once you become an active student and attend Frontier Bound. So the takeaway from this is just know that when you come to Frontier, you do have to find your own clinical sites, but we are here to support you in that search.
I would like to just add, while we're on the topic of clinical sites, since of course that's my area, since I'm the clinical director, don't be scared when she says that. We're in the business of helping our students. So she talked about that community map with lots of sites. Your clinical faculty also know their region. So we have a ton of sites, but we also have a ton of resources to help you. So if you get stalled in your process, your clinical faculty, the clinical outreach department will help you come together. So all of our students get supported in that way. Okay, so I don't want that to scare you. Okay.
Yes, and I'm so sorry if I scared anybody. No. Thank you, Dr. Nancy. I will say that I have never worked with anybody that has left Frontier because they couldn't get clinical sites. So just know that too.
Good point. All right, next, there we go. Okay, so let's talk a little bit about what degrees we offer. We have 3 degree options. You can earn your Master's of Science in Nursing, a postgraduate certificate. And what that means is this is the student who already has their master's degree and is already an advanced practice registered nurse, and they come back to school to get a postgraduate certificate within another population. So that could be a certified nurse midwife who comes back to school to get the family nurse practitioner postgraduate degree. We also offer the Doctor of Nursing Practice degree. You can see here a little bit about the time frames. So we operate on a term system. We have 4 terms per year, and the terms last 11 weeks, and then there is a 2-week break. Then it just goes on and on and on. Generally speaking, MSN students will take about 2 to 3 years. It depends on lots of different factors, if you are working and how much you're working. But we have a pretty nice system, structured system that helps march you through that process. The postgraduate students, certificate students, will not have to take some of the core courses that the master's degree students take. So their time frame is more like 1 to 1.5 years. And then our DNP students, generally speaking, take 18 months to complete that degree. And I think this is Tamika.
Yes. So we'll talk about what's needed for qualifying for the program. Applicants must have their BSN degree. If you do have a bachelor's in another field and you have your ADN, you are still welcome to apply. A 3.0 cumulative GPA from the highest nursing degree earned. Do have to have a current active RN license in the United States with no encumbrances. Good academic standing in prior educational work, and 1 year of RN experience. Next slide. And then also for the postgrad certificate, still need that active RN license in the United States with no encumbrances. Do have to have your master's or higher degree in nursing, a cumulative GPA of a 3.0. And then your MSN does have to have an NP specialization, and those specializations are listed there. And then also a PRN license and board certification if you have it. Right now, we are accepting applications for the winter term, which starts on January the 6th. The application deadline to have all materials in, including transcripts, is September the 25th. And then the next upcoming would be our spring term, which begins on April 7th. And then that application deadline is January the 8th. And those applications open on September the 26th if you're considering spring. As far as the application goes, the materials needed, of course, you would need to complete the online application. There is a $50 application fee. Please keep in mind the application fee is non-refundable. So if you would need to delay admission or need to move to another term, you would have to reapply. There is also an essay, a resume, and the portfolio would be for those who are applying with an ADN and a bachelor's in another field. Currently for tuition, the current cost per credit hour is $685.
Dr. Pesta-Walsh, do you want to speak to the clinical experience?
Sure. So our MSN students will do 750 hours and a minimum of 16 weeks in clinical. PGCs are also required to do the same amount of clinical hours. And the PGCs do clinical hours. This is a change that is across all programs in the country, that it's a non-standard for all programs. Only our students do 675 hours, and that is changing, and we're just meeting the standard that is being set for all programs, nurse practitioner programs in the country. We do have clinical sites. Oh my gosh, I'm so sorry. My brain stopped working. Site visit types that we require. So it's competency-based experiences across the lifespan. So we require you to see a certain amount of newborn visits, pediatric visits for well childs and episodics, and same with like adults, episodic well child or episodic wellness visits and chronic care, geriatric, things like that. So we do require that in addition to the hours. Most students have no trouble getting our competency requirements completed within the time frame of the 750 hours.
Next slide. All right, so this slide is a little bit of a who's who here at Frontier. So I am the department chair, and you've also met Dr. Nancy Pesta-Walsh. She's our clinical director. All of our courses are set up with a course coordinator and then course faculty. So the course coordinator is the person who is in charge of running the course as a whole. Generally, they also have students that they manage throughout the course, but they also have course faculty, and the course faculty role is to work with students and facilitate their learning. The course coordinator is kind of like the boss of the course, and the course faculty are working within that course to assist both students and the course coordinator. Dr. Pesta-Walsh talked about the regional clinical faculty. These faculty are particularly experts in clinical education. So it's bringing it all together for you. They are regional, so they have expertise in their particular area. They also have networks and contact and just to assist students in their own region. We talked about the academic advisors and the clinical advisors. We have financial aid officers who will help you figure out the financial aid piece of it and keep all of that coordinated. And then we have credentialing coordinators. Our credentialing coordinators work sort of on the back side of things, making sure that clinical sites, preceptors, and students are all contractually and credentialed for these clinical sites for you to do your clinicals. Next slide, please. And here is a picture of our beautiful campus. We'll start down here at the Frontier Nursing University sign. That's the first thing that you'll see as you pull up to our campus. And then right next to that picture with the folks walking on the sidewalk and the flags there, that is our dining hall. So we do have a chef that provides food meals for us when we're on campus. That will be when you come for your orientation and also your clinical immersion. So your food will be available, will be provided for you. That's 3 hot meals a day. And it's a really nice experience. They do a great job with that. Next picture over is a picture of the student dorms. So we have our student lodges. Sorry, that's what they are. And we have 3 student lodges. Up above that, you see that's just a close-up of one of our student lodges. Students have their own private room and shared bathrooms. There's a nice living space. There's a nice functional kitchenette, probably more like a kitchen than a kitchenette. And so it's very functional for your stay on campus. The top center picture is the president's house, and that is where we host some functions. For Frontier, also, we typically will have a celebratory evening when students are on campus, and you can come in and tour the president's house. And then right next to that is the Student Welcome Center. So that is where you would check into the campus and get your materials, your lodge key, directions, and instructions when you arrive on campus. It really is a beautiful campus, and these pictures don't do it justice. There is a functional gym on campus. There's a gift shop. There's walking trails. It really is beautiful, and it's designed to keep us all comfortable and safe when we're on campus. Next slide, please. So here, this is just a little QR code if you want to scan that, or you can visit our website with any follow-up to any, so we can answer any questions that you have or submit any additional questions about the program. We'll give you a minute with that slide and then we'll go to the next one. And we're going to have some time for question and answer as well when we finish with our slides. So let's just take a minute to talk about life as an FNP. I know everybody comes to this decision with different things in mind about what you want your life as an FNP to be like. I can tell you from my own experience that it is a decision that I have never regretted. It opened doors and opportunities for me that I would not have had otherwise. What I like the most about being an FNP is also a bit of what I liked about being an RN. Like we have that opportunity to meet patients where they are, to connect with them. We are with our patients sometimes at their best, sometimes at their worst. Either way, it's still the nurse that is with them. So being able to take that to the next level, such that I could be the medical provider and help chart the course for their medical care, has always been one of the things that really spoke to me about my life as an FNP. Dr. Pesta Walsh, do you?
Yeah, all of what you said and more with, I like the variety of the opportunity that I have. I've worked family practice, I work in a walk-in clinic, I've worked in an urgent care. I like all of it. So I like the variety that you can get. So if there's one area that doesn't quite fill your cup, you can do something else with it.
A good point.
I would say, too, I've never regretted the decision to go back to school.
Next slide, please. Okay, so we'll pause here for a minute and take any questions that you have about clinical placement or admissions. And you can just speak if you want to turn on your microphone and ask your question. We also have the chat box here available if you want to put any questions in there. Clinical placement tends to be one of the topics that generates the most questions. Students like to, know how many hours and what kind of clinics and that sort of thing. And all of that is laid out very nicely for you when you come to the orientation on campus. But for tonight's purposes, your clinical, like this is a primary care FNP program. So your clinical will cover the entire lifespan. So you'll likely have pediatric site. It also includes primary care, adult primary care, newborns, geriatrics, so the entire lifespan. So you'll have a primary care clinic, you might have a pediatric clinic, you might have a women's health clinic. We've got a question in here. Shelby is asking, when will acceptance decisions be made for the winter term that begins January the 6th? Tamika, do you know that answer?
So yes, I was typing, but I can go ahead and voice it. No problem. So once all of your application materials are received by your admissions counselor, the file will be submitted for review, and it can take up to about 4 weeks.
The cohort size. You're welcome, Shelby. So Christine asked, what is the cohort size? And I would say probably anywhere 70, right around 70 is our cohort size.
And Miles asked a question, are clinical hours covered at one site or spread across it? Majority of students have more than one site. Think of, getting the totality of 750 hours. You might have one or two family practice sites. You might need an additional ped site. You might need an obstetric site to get your antepartum visits in. And sometimes students will choose to do a specialty rotation. So you can have up to 4 sites, and I would say most students do 3 sites to get their variety in. I would say it's a very rare student that only has 1 site for all hours and visit
Yeah.
types.
That's a good
But,
answer.
you know, there's benefit to seeing more than one preceptor. You get to see and work closely with them. So you see how they see patients and see what they do well, and you see what they maybe could improve upon and how you're maybe not going to practice too. So it's really good to get a broad experience.
Thank you. All right. And then Renee asked, what kind of background in nursing do most people have prior to starting FNP? Renee, it's all over, right? I mean, a lot of folks come from an ER or ICU background. We see a good bit of that. We also see a good bit of students who maybe specialize already in something like cardiology or women's health or something like that. So it really is fairly broad. Um, Even to include case management, home health, women's health. Some of our students are already working in primary care practices. So it's really pretty broad. Dr. Pesta Walsh, do you?
Yeah, I would say that. I would, this program and really any NP program, you're an advanced practice registered nurse. So if you don't have a really good solid base as a registered nurse, then I would encourage you to get that before you try to get this degree, because we really do rely on good assessment skills. Not that it's impossible to do, you can do it without that, but it's a little bit more challenging. So good hospital experience, good assessment experience, but really it's variety. We have students with every kind of background. There was another question in there. Can you follow NPs or no, do you need NPs or MDDO? MDDO is acceptable for up to a certain percentage of hours, 40% of the hours. And you also can use midwives, so certified nurse midwives and like women's health NPs to get like the antepartum or a pediatric NP or an FNP. So there is a good variety. At
Right.
this point, we don't allow physician assistants to be preceptors. And I'm not sure that that's changing anytime soon. We really do want to prepare you to become nurse practitioners, and the scope of practice is just different. And so having a solid nurse practitioner foundation is what we strive for, and that's our goal. But we do allow the physician time as well.
All right. And the next question is from Hadaza. I hope I said your name correctly. I apologize if I didn't. How much aid will we get in finding clinical placement? You've seen many people have trouble finding clinical sites and posting on local Facebook pages. Katie, do you want to take that one?
Sorry, I have multiple screens, and so I was trying to find you. So we help you as much as we can. So we are here to support you from the beginning to the end type thing. And like Dr. Pesta-Walsh said too, your clinical faculty, we call them a regional clinical faculty. They're a clinician and they are familiar with the regions that at various states where clinical sites are. And so they have local connections as well. And it depends too on how, well you're connected in your community and sometimes who you know. But like I said earlier, I mean, I've never known a student to have to leave Frontier because they haven't found a clinical site. Sometimes students, live in saturated areas, and sometimes you live in a really rural area, and so you don't have a lot of choices. But one of the beauties is too of Frontier is that you are able to go out of your home state. So some of my students actually view this as a chance to take a vacation almost and go to a different state and rotate in a different state and get their clinicals in there as well. So that is a perk, or I would count it as a perk. But I would say that, I mean, it sometimes can be challenging, but then other times it's a breeze. So
I think
And
finding a preceptor can be very, very stressful, very anxiety producing. So you guys are the experts in your area. You know what's around you in your home, where you're even better than us as clinical faculty. I live in Minnesota and I have states that cover the Midwest. Well, I'm pretty good at knowing what's around me. You guys are the experts in your area. So the best course of action is you network, network, network. You talk to people at work. When you get told no, you ask, do they have any friends that might consider it? We're really good at finding and helping you find sites. The biggest thing is that if you're in a very rural area, or you're in a challenging area, you may have to expand that circle out a little bit wider and a little bit wider until we find placement. Some students do have to travel in order to get clinical sites because of their location. And it's a, short-term, finite amount of time. While difficult, school in general is difficult. So we do our best to support you. And again, our students graduate, that we do help them, and we do get them through this process.
what I would add to this discussion is when you come to Frontier, you do all of your didactic or all of your classes right first. So it's front loaded with those courses. And then your clinical comes at the end. So it's the last part of your educational journey with Frontier. And what that means is you have some time. So you start the program, you're in your courses, you're doing your coursework, and generally you have a year to a year and a half before you even start clinical. PGCs may not have that much time, but MSN students generally do. So it's something that I would just start early and access the Frontier resources. So, in your first term, start talking to clinical outreach and placement, come up with your plan, and then attack the plan. Like go out and do the work of finding the preceptors. It sounds daunting, but honestly, it happens. Our students get preceptors, and like Katie said, we haven't turned anybody away. Nobody had to quit school because they couldn't find a preceptor. So our next question is from Natalie, who's a certified nurse midwife, FNU grad. Yay! Hi, Natalie. And you have 14 years of experience. In fact, you've been a preceptor for Frontier FNP students. Thank you so much, Natalie. We appreciate that. As a PGC student, would you be required to complete the OBGYN visits, or could they be waived? We cannot waive those visits because of accreditation. So if we as a university say that an FNP degree includes these OBGYN visits, then we have to honor that, and we have to still require that as part of the FNP degree. I will tell you, though, that the OBGYN visits for the FNP student are not, they will not take long. They might take, I'm sure you have contacts and you would be able to find a busy site, and I would bet it wouldn't take you much more than 80 hours.
Or less is my guess. Significantly less for a seasoned person that knows what they're doing.
So I hope that helps you, Natalie. These are great questions. Any other questions while we're on this slide? Okay, let's move on to the next slide, please. I love this picture. This is Dr. Tarika Fuller here. She is helping pin one of our graduates. Look at that smile on both of their faces. We celebrate your success just as much as you do. And we help you go for it. So success doesn't come to you. You have to find it. And we are right there cheering you on as you do. So I love that. Next slide, please. And then again, here's some website information for you. You can reach out to admissions with any admissions questions, clinical advising with any clinical questions, and financial aid if you have any questions about financial aid. Look at these pictures of folks in their community. This is another good one, resilience, which is adapting well in the face of adversity. Trauma, tragedy, threats, or significant sources of stress. Look at the smiles. This is our graduation. We have a graduation ceremony every September. Sorry, we used to have them in October, and I had a momentary lapse back to that. So it's a fabulous day. People come back to Kentucky, and we celebrate their graduation. And then the faculty there, that's Dr. Pesta Walsh and myself. And then in the red is another one of our fabulous faculty. Her name is Dr. Diane John, and you would meet her in your pharmacology course. Next slide, please. All right, so there you go. That's our presentation. We are so happy to have been able to spend this time with you. We can hang out for a little bit if there's any more questions, but we would love for you to ready, set, jump. Come our way. We're ready.